Hey guys, sorry I haven't done any kind of update in a while. I just wanted to do a video and let you guys know that I had my doctor appointment today and results came in and I am officially diagnosed with PCOS, polycystic ovarian syndrome. I'm sure some of you know what it is. If you don't know, it's basically a hormone. It's all associated with hormones. They did an ultrasound on me 2 weeks ago, and they had seen a lot of, I can't talk right now, cysts all in my ovaries. I had a ton of them inside. So yes, I was diagnosed with it. It's a bummer because it is very hard to get pregnant with PCOS, and if you do get pregnant, you're very high at risk of having a miscarriage. So yeah, hearing that was a bummer, but I had been told before when I was seeing a natural fertility doctor that I had that. She just couldn't diagnose me with that because she wasn't a doctor. So yeah, my doctor officially told me that I have it. The treatments for it, there's a few different things I can do. One is going on birth control, which isn't an option for me since we want to have a baby. The other option for me is taking hormone injections and basically just getting me balanced, which should hopefully get rid of the cysts and get me regular and start getting my period. He also told me women with PCOS, they ovulate at random times. So sometimes you can ovulate only a few times a year. Sometimes you ovulate like right before your period's supposed to start, just random times. So it's very hard to track when you're ovulating and try to get pregnant. So he said still try, you can get pregnant on it, but you're very high at risk having miscarriage. So he recommended me to start going and seeing a fertility specialist. So I found one that's really close to my house, San Diego Fertility Clinic. I'm going to start seeing them next week. I have a consultation and they want to see my scans and make sure that I for sure have it, and we'll go from there, and hopefully they can get rid of this and help me get pregnant. So my doctor that I talked to today, his wife suffered with PCOS and they couldn't get pregnant for like 4 years, and finally she had to go get IVF. So that might be my only option. In the meantime, I will keep trying. I will keep tracking my ovulation. It's a bummer that I have this little obstacle in my road, but it's okay. I'm gonna get pregnant. It will happen. I just have to stay positive. I kind of had a little bit of a breakdown today, but it's nothing, that will kill me. It's no disease or cancer. It is definitely curable. So I don't know anyone out there that's watching this that have PCOS or they have any kind of experience with it. Leave any comment down below. Any advice I would love to hear on what I should do. So my first step is definitely going and seeing this fertility clinic, having them look at my hormone levels. They'll do blood testing, and then we'll just go from there. So hopefully they'll be able to help me. So yeah, it's a bummer, but it's okay. I'll be fine. A lot of women have this. My doctor was kind of shocked that I had it because he's like, you don't look like the kind of person that would have PCOS. So I had told my OBGYN last year when I went to see her, it was a new OBGYN, and I asked her, I had been told by a natural fertility specialist that I have PCOS. Do you think I have that? Can I be tested for it? And she laughed at me and was like, you don't have it. You don't have it. I can look at someone and I'll know when they have it, because I guess you get facial hair, acne, obesity, overweight. She said that I just didn't have those characteristics or features. So yeah, I kind of just ignored it and was like, okay, I don't PCOS. So I'm really glad that I got this ultrasound done and they caught this right away. So that way I can just, and now that I know what's going on, we can go from there and work with it. And yeah, so in a way, I'm very happy that I have an answer and I'm not kind of going in the dark about it, you know, because I did miss my period this month. I have not had my period since May, but it's very odd because I've had a period every month for the last 2 years, but before that, I had them every 3 months, which explains the PCOS. So it's weird that I had periods every month for like 2 years, and then now I'm missing 2 months. So it's very odd, but what can you do? So yeah, I mean, he told me to still keep trying for a baby, but I'm more likely to have a miscarriage, so I'm kind of nervous about that. So anyways, yeah, that's the news on that. I had something kind of interesting happen to me the other day. My sister-in-law, her sister has always been known to like predicting pregnancies, and she's always been right. She predicted my sister-in-law's pregnancy with both her babies. She predicted her other sisters, all of her pregnancies. She predicted down to the sex of the baby, when it was gonna happen, and she randomly messaged me like 2 days ago, and I barely know her. She found me on Facebook, and she's like, hey, you know, I know we haven't really talked that much. This is probably gonna be really random, but I had a vision come through that you are gonna be pregnant really soon. So I thought that was kind of interesting and cool, because I've always asked my sister-in-law, because I know that her sister has always been known to being psychic. I'm like, let me know if Liz ever sees anything, you know, regarding me being pregnant, because she always calls the pregnancies. So my sister-in-law was like, no, she's never said anything. So getting that message from her was really cool, and I kind of like, I don't know if I totally believe in that stuff, but she's been right with all of them, down to the sex. So I don't know what that means, but I'm like, well, when am I going to be pregnant? And she's just like, I just saw it in the future really soon. Usually when she gets the visions, it means that it's going to happen soon. So that's a little bit of hope, I guess. I don't know. But I just wanted to share that with you guys, and that way if I do get pregnant, we'll have that to go off of, and that'll be kind of funny if I do. So anyways, yeah, that's the whole story on that. I'm still, I've been feeling really sick. I think in my last videos I was on my vacation and I was telling you guys how crummy I've been feeling. I'm still feeling crummy. My boobs hurt. I'm having weird achiness in my ovaries, which explains I have PCOS, so you do get achiness because you have cysts that are bursting. So now I kind of have answers, so I'm kind of happy, you know, that I now know what's going on. But I did tell my doctor, you know, I missed both my periods last month and this month, but I'm having complete period symptoms, so what does that mean? He said, you know, keep doing pregnancy tests, you could be, or it could just be your hormones are out of whack, because with PCOS, they are kind of out of whack, and they're not really, I don't know, he explained it to me. I can't remember all what he said, but it could be associated with the PCOS. So anyways, yeah, my next step is the consultation with the fertility specialist next week. So after I see them, I will do another video and let you guys know. Hopefully we'll get kind of a game plan. I don't want to wait too long on this. If I can't get pregnant by myself, then I am completely down to try other things. I know April and Matt in their videos, they did IUI for a while. I would be down to try that first, and then if that doesn't work, then IVF. I mean, it's pretty successful. So yeah, we'll see what my options are, but I feel like it's going to be somewhat of a journey. So thanks for following me and hopefully coming along on this journey with me, and I'll kind of let you guys know how everything goes. So yeah, I'll do another video after my consultation next week, and I'll let you guys know the game plan is on that. All right, thanks guys. I'll talk to you soon. Bye.